I want to thank you for joining us in the 11 Breaking News Center. I'm Lauren Watson, your digital anchor here at KKTV 11 News. I'm here today with Steve Carleton, the Front Range Clinic Chief Clinical Officer. Now, Steve, today, October 10th, is World Mental Health Day. Why are mental health issues often a component of substance use disorders?
Yeah, it's good to be with you, Lauren. That's a great question. So, on World Mental Health Day, what people need to understand is that substance use and mental health issues a lot of times go hand in hand. And the reason they often go hand in hand is that substance use is a really common way people self-medicate mental health issues. If you're feeling depressed or anxious, or you have had a traumatic life experience or some other significant event, typically people turning to drugs or alcohol is a common way to find relief.
Now, you mentioned these things go hand in hand, but can you treat both substance use and mental health issues simultaneously?
Yes, and that is the best way to do it. So what we know is that if you have a substance use disorder that's as a result of an underlying mental health issue like depression or anxiety, if you don't treat them simultaneously, it's like you're taking away someone's coping skill. If you stop using substances but you don't replace that with some other type of coping skill, it can be very difficult for that person to manage life and manage what they have going on. So you do need to treat both concurrently.
Now, is there one mental health issue that comes any more frequently with substance use issues, or is it kind of a case-by-case basis?
Statistically speaking, it's somewhere around 60 to 70% of people with a substance use disorder have an underlying mental health issue. And that could be PTSD. That's a really common one with a substance use disorder. So with post-traumatic stress disorder, one of the key symptoms of that is avoidance. So people don't want to think about it. They don't want to talk about it. They don't want to confront it. And often they're left with high levels of anxiety and distress. And so using substances, if people are experiencing PTSD, is perhaps the most common. But things like depression and anxiety, what you see often there is this trying to get an understanding of what came first, the chicken or the egg. Did the substance use sort of drive that depression, drive that anxiety, or were they experiencing depression and anxiety, and the way they started to cope and deal with it was using substances? So I'd say by far PTSD is probably the most common one that you see with substance use disorders, but depression, anxiety, other mood disorders certainly occur quite often as well.
Now, when it comes to these substance use disorders, does it matter how early that you catch it?
It does. And another great question. So when you are thinking about treatment, right, typically people wait until there's sort of some major consequence or some major sort of life event before they seek help, right? Oftentimes people they're nervous about seeking therapy or types of services, and so they wait too long. And by the time they come in, the substance use disorder has become severe. If the substance use disorder is in the early stages, like in that mild to moderate realm, it is possible for people to address that underlying mental health issue and return to a state where they can drink or use moderately. But if people have waited until it's severe, in those later stages of severity with a substance use disorder, it's harder and harder to return to moderate use. So catching it earlier is always your best bet.
Now, Steve, is there anything that I didn't think to ask you about the concurrence of these two, of mental health issues and substance use disorder, that you think is really important for our audience to understand?
Yeah, on World Mental Health Day, I think most people are aware right now that suicide rates are very high, and those have sort of gotten more and more concerning over the years. And I think what people should know about mental health and substance use is using substances and having a mental health issue underlying leaves people at higher risk of dying by suicide. And so if you have a loved one that's struggling with both of those things, it's always good to check in and ask the question and be direct if you're worried that they might die by suicide. Ask the question.
Well, Steve, thank you so much for talking with me today. If there are people looking for help with these sorts of issues, how can we find you?
So Front Range Clinics, we specialize in medication-assisted treatment. So if people are struggling with a substance use disorder and are interested in medications that can help curb cravings and mitigate risk, and they're looking to get some counseling and some support, the best way to get a hold of us is 866-MAT-STAT.
Awesome. Well, again, Steve, thank you so much for taking the time out of your day to talk with me today.
Yeah, thank you, Lauren.